to comply with, and these standards are monitored by the Office of Health Standards Compliance. Healthcare management is a step toward enhancing the quality which is to be kept in healthcare management in the line of the 10-point program of the Department of Health. Over the past few years, the funding for the Department of Health has grown by 15.3% from 21.7 billion to 25.7 billion. Also, 8% or more of the GNP is spent on the national health system. The beds in private health sector constitute only 21% of the total South African population. The other 79% is in the public sector. This stat is important to note because of the number of Africans that cannot afford good quality beds in hospitals. It is not fair for patients to be treated unfairly. So all South Africans are citizens of the nation and deserve fair and equal treatment irrespective of their race and gender. In November 2011, the Cabinet approved the National Health Amendment Bill for Office and Health Standards Compliance, which will accredit health facilities. In preparation, the department put in place quality norms and standards, which cover the availability of medicine, supplies, cleanliness, patient safety, infection prevention and control, positive attitudes, and waiting time in all health facilities. Having public care health facilities can improve society's health and ensure that all life expectancy of all is great. Currently in South Africa, the male species, has a life expectancy of 56 years and females of 58 years. Government must work to eliminate the burden of tuberculosis and improve system effectiveness. I did a comparison of SA and Brazil, and I found that in Brazil, healthcare services are free for legally registered citizens and as well as foreign residents. There's also another country I researched where, I think it's Spain, where they offer free healthcare to anyone, even if illegal, illegal people who cross borders illegally. The Brazil use the unified health system. That's the policy that they have, which was created in 1988 in Brazil with alignment to the new federation constitution, which made access to healthcare a right for every citizen, which is similar to the Bill of Rights of South Africa. The people who can afford to pay for healthcare can rely on the free public national health system, which will pay for all types of healthcare facilities. Private healthcare in Brazil also exists, and it is a better choice. In Brazil, only 20% of the population use private healthcare facilities. The good thing about the free healthcare in Brazil is that people can use the healthcare system to also pay for private hospitals.
At the 2012 State of the Nation speech, President Zuma said that we must confront the fact that life expectancy at birth has dropped from 60 years in 1994 to just below 50 years today. President Zuma's speech effectively recognized the extent of South Africa's health crisis, not because the figures he quoted are worse than previous estimates, but this states that there is a health crisis in South Africa. According to the World Health Organization, the general goals for all health systems are to maintain stable and good health for all patients, to acknowledge and to meet expectations of the population, and to give fair financial contributions to the various health centers. However, if you were to focus on the struggling healthcare services in South Africa, it would appear that the WHO has not managed to meet their goals successfully. The World Health Organization has placed universal coverage on the global health agenda, defining 3 dimensions of coverage. Firstly, the provision of population served. Next one, the level of services. And lastly, the provision of health costs covered by prepaid code funds. WHO has defined universal coverage as access to promotive, preventative, curative, and rehabilitative health interventions for all at an affordable cost. The private sector is well entrenched in South Africa and has begun substantial international acquisitions. For example, the medical aid industry has extensive investments and activities on a regional and international scale. The major hospital groups have acquired hospital groups in the UK and Middle East. The pharmaceutical industry is integrated with Global Pharma, which has joint ventures with Cuban, Indian, and Brazilian countries. At a service level, cross-border referrals and medical tourism is a growing business area. Emergency medical service provision within Africa is increasingly both as support to South African capital as it moves into other African states. Section 47 of the National Health Act makes reference to the following critical statements. Evaluating services of health establishments. All establishments must comply with the quality requirements and standards prescribed by the Minister after the National Health Council. The quality requirements and standards in subsection 1 may state health technology, equipment, hygiene, premises, and delivery of health services. The Office of the Standards Compliance and Inspectorate for Health Establishments must monitor these facilities. Planning and management skills are still weak at all levels in public institutions, especially in hospitals. Management systems need to be upgraded. Essential management information is lacking at all levels in the health system. Ensuring cooperation between public and private sectors, including PPPs, which are public-private partnerships. Other factors that may explain the greater use of public sector over time include a growth in private provision. Early data indicated that despite a moratorium on the private hospital development, the number of beds have increased over time, and this may help explain the finding of increased use of private sector in rural areas. Before 1994, many public hospitals in small rural towns were served both the insured and uninsured citizens. But with the growth of privatization provision, it is possible that the insured are being served by private facilities. With regards to what my opponent said about a dedicated workforce.
This is the rebuttal now. You're doing a rebuttal, and then you're going to rebuttal back to it, okay? Because, like I'm saying, when you read, it takes up more time.
Yes.
So kind of just ad-lib the rebuttal. Just point out to them what it is that you disagree with without reading.
Okay. As what my opponent said earlier about a dedicated workforce, how can this be true when an assessment by WHO in 2003 found that more than 60% of health care institutions in South Africa are struggling to fill posts, with more than 400 vacancies for general practitioners and upwards of 32,000 vacancies for nurses throughout all provinces. Another aspect that my opponent spoke about is effective financial systems in public institutions. By the Department of Eastern Cape, Dr. S.N. Pillay in 2010 found that another byproduct of weak management, ineffective financial systems, and lack of skills is deeply systematic with corruption in public health care hospitals. Is healthcare improving? Because I know you spoke about, you said that healthcare in SA is improving in public institutions. Facilities of public service institutions should be accessible and noticeable to all systems. So in this regards, public health care institutions should be measured according to the standards which I spoke about earlier. Statistics show, firstly, my opponent said that providing healthcare public institutions provide healthcare systems for young mothers. Yes, they do, but is it equitable and efficient? Statistics show that most women have lost their babies due to a delay in service by nurses in rural clinics and hospitals due to the lack of staffing and protocol, inadequate nursing, and also inadequate facilities in rural areas.
Okay.
Just address them, extemporaneously, without reading, Just tell us, rebut, and,
Okay.
wrap up.
My opponents have stated quite a bit about the public sector. I'd like to touch, with the private sector, you're looking at money. And majority of, yes, they cannot afford the medical aid schemes that are going on. So fair enough, the World Health Organization has laid forth some of the stuff you have mentioned, but it all comes at a cost. And not everyone can afford this, right? I know that with the private healthcare system, 11,300 rand has been spent per person, whereas in the public sector, 2,500 rand was spent. So, but the people are still living. I mean, the population is still there, and although you may say that the facilities are bad, but the fact is it's there, and we are catering for that purpose. Also, the private healthcare system is profit-driven.
Okay, just a couple last points. Anything you want to?
Also, doctors, right? From my research I've done, many private doctors don't work in hospitals. They open their own practices, and there is a lack of doctors in the public sector. So doctors need incentives in order to come to the public, onto the public side, and this all involves money. So at least the government has like the NHI scheme to at least help the public get adequate and also pay for all the facilities and doctors that are out there, just to bring them to the public side.